In this quick presentation, we will go over the do's and don'ts of infant feeding. For the first 6 months of life, breast milk or formula provide all the nutrients a baby needs. The possible exception to this is vitamin D, and a supplement may be advised for infants. Foods should be introduced one at a time, with a new food being introduced every week or so. This allows a caretaker to watch for possible signs of allergies. One objective in feeding babies at this age is to build up to a varied diet by introducing many different foods, even ones we don't personally like. Remember that babies may potentially need many more exposures to the same food before they begin to like it. While food should not be forced on a baby, it certainly needs to be introduced over and over. At this age, infants are likely not self-feeding. This means that the care provider has to decide when to stop feeding the baby. Watching for signs of fullness is important in order not to overfeed the baby. Babies will often show that they're full by turning away or not opening their mouth. Babies are good self-regulators of their calorie intake, so respecting these signs is crucial to allow them to dictate how much they will eat. While it is okay to offer the same foods to babies as what the rest of the family is eating, it's important to keep in mind that babies need much more fat than adults do. Adding healthy fats, such as avocado, fatty fish, and whole milk or yogurt, will help provide babies with the fat they need to help their nervous system develop. Offer many types and colors of fruit and vegetables to the baby's diet. These contain important vitamins, minerals, and phytochemicals important to the infant's health. These foods and grains contain natural fiber, so they can be bulky, filling, and low in calories. While this is good for adults, babies' calorie needs are relatively higher, so focusing on including plenty of other foods is important. The sugar that is naturally found in foods, such as in milk and fruit, is plenty for babies. There is no need to add additional sugar to foods. While small portions of 100% fruit juice are okay, too many sugar-sweetened beverages contribute to cavities and childhood obesity. While sodium is an important nutrient, the average intake of sodium in infants is greater than the RDA, so salted or processed foods should be limited. The minerals iron, zinc, and calcium are especially important in the first 2 years of life and are important for blood and bone health as well as optimal growth. While some toddler foods such as cereals and crackers are fortified with these minerals, including other food sources of these is important. Now that we've reviewed a few guidelines for what to feed infants, let's go over what we should avoid feeding them. After the first 6 to 8 months, the proportion of solid foods compared to breast milk or formula should increase. At that point, 24 to 32 ounces of breast milk or formula per day is sufficient, with solid foods providing the remainder of the calories. Choking hazards include round or oval-shaped foods, such as grapes and slices of hot dogs. These should be avoided along with sticky foods such as nut butters and other foods that may be hard to swallow or could get stuck in the esophagus. Think of a baby's esophagus being the diameter of your pinky finger, and think about whether or not a food might get stuck going down a tube that diameter. Infants should always be monitored while eating, and caregivers need to sit through the baby's entire meal to watch for signs of choking. Common allergens include cow's milk, egg whites, peanuts, tree nuts, soy, and wheat products, and should not be introduced before 6 months of age. After that, a pediatrician or dietitian can advise caretakers on when to introduce these foods, keeping family history of allergies in mind. Cow's milk should be avoided before the age of 1, as it does not provide the nutrition an infant needs. Breast milk or formula should be used until 1, at which point the baby can switch to whole milk. After the age of 2, the baby can then be switched to a lower fat milk. Goat milk is low in folate, iron, vitamin C, and vitamin D, and should therefore not replace breast milk or formula. Excessive juice above 4 to 6 ounces per day can lead to diarrhea due to its high content of fructose and sorbitol. Caretakers should be mindful that the infant get enough milk or formula and that the fruit juice doesn't displace the calories and calcium that milk provides. Food safety is important at any stage of life, but even more crucial for a baby's immature immune system. Raw milk, soft cheeses, undercooked meat, poultry or fish should be avoided. Honey potentially contains Clostridium botulinum, which can cause the fatal foodborne illness botulism. It should be avoided until 1 year of age. Finally, frequent and proper hand washing is crucial. Many foods are already fortified with nutrients. The focus in feeding infants should be to introduce a variety of foods that lead to a healthy diet. Supplements, if needed, should not exceed 100% of the RDA for infants.